and I'm live at this moment in time with Dr. Shaikh, who is an MD in homeopathy, and he works out of India and also Dubai. And he's going to be talking with me today about something called German New Medicine. You may not have heard about what German New Medicine is, but trust me, the person to go to is certainly Dr. Shaikh. So I can see Dr. Shaikh on the screen. So Dr. Asher, thank you so much for coming on my Insta Live series, and welcome. And Happy New Year as well.
Happy New Year. Thank you. Thank you. Thank you. So I'm not able to see.
We always do have these technical issues as far as Insta Live is concerned. Insta Live is quite tricky.
Yeah.
But hey, we did actually, for those listening, we did try.
Yes.
We did a test run and it worked perfectly fine. But hey,
so I'm not able to see myself. Is that okay?
That's fine, because I can see you fine and dandy, as they say.
Okay.
Yeah.
Fine.
You look very elegant and very charming.
Thank you. Thank you. Same to you. Same to you.
Now, I originally got in touch with Dr. Asher Shaikh through Instagram, actually, through social media, and we since have become good friends. And I thought it would be very pertinent at this moment in time, because remember, if you are following my reels at @like_treats_like, I am very, very committed to the fact that this year I strongly feel is going to be the year for homeopathy. That's why I'm wishing everyone a very happy homeopathic new year. And incorporated in that is, of course, something called German New Medicine. And it's a slightly different take on homeopathy. So, Dr. Asher Shaikh, if I could ask you, really, for the new listeners, of course, and the viewers that will listen to this Insta Live afterwards, because it will be saved to my Instagram Reels, do introduce yourself, and then if you can also introduce German New Medicine to us.
Right. So I am a homeopath who has been practicing now since 27 years. I have my clinics in India, and now I've just latest started in Dubai. So all these places, when I go, we have a busy practice, when the practice really becomes busy and you need to give too much of time to patient, it really becomes difficult. It really becomes difficult. And when we see and learn the aphorisms, the first 5 aphorisms, Hahnemann has put a lot of pressure on understanding the knowledge of medicine and knowledge of disease. Knowledge of medicine we learn from Matra Medica, we learn from the stalwarts, we learn from our teachers.
I think the sound has just cut off there, Dr. Asher.
Now it's back?
That's fine.
Now it's
That's
back?
fine. Yes.
Yeah.
The joys of Instagram Live, eh?
Yes. So what happens is, when it's a busy practice, you need to be accurate. And as Dr. Hahnemann says, you also have to have knowledge of disease, right? We all run behind understanding the drugs, the Matra Medica. We polish ourselves to the, we put all our understanding and memory, everything behind understanding medicines. But when it comes to knowledge of disease, that is where Dr. Hahnemann has said, you need to apply the knowledge of medicine to the knowledge of disease. Then you will get cure. And that knowledge of disease is where we lack in our practice. And that leads into, after giving medicine, we don't know what to do, what to expect after the drug goes inside. What will be the changes the body will show? That is what we need to change. We need to understand. We need to really go and dig deep. And that made me go and understand German New Medicine. Now, German New Medicine, I have learned under Dr. Caroline, who was a direct disciple of Dr. Hammer. Now, Dr. Hammer in Germany was the biggest oncologist. This is for all the new people who have joined, who want to know about German New Medicine. Now, Dr. Hammer was an oncologist. When he, in his successful time, was traveling with his son, in a yacht, the pirates attacked and he was shot. The son got shot. And when they came back after some days, the son was no more. And Hammer and his family were in a big shock. They were into a lot of grief. But after some days, when the son was no more, this Dr. Hammer suddenly got a testicular swelling, a testicular swelling. And he was wondering why I am getting this testicular swelling suddenly. Then what idea came to him is he went and checked all his patients in the hospital who were suffering from testicular cancer. And for his discovery, whatever came out after that, he found that everybody who had a testicular cancer or swelling had lost their child. And that was something very new for him. He immediately went and investigated and found that everybody in his CT scan, whoever was suffering from a testicular cancer, had a concentric circle in the brain which connects to the testis, the part of the brain which connects to the testis.
Right.
It had a concentric circle, which he later on named as Dirk Hammer circle, DHS. Now, that is what made him understand that every shock or every grief or every emotion is first registered in the brain. The psyche, what you go through, then it gets registered in the brain. From that part, the brain which relates that organ, which is required to get activated for that requirement of that person, what he wants to fulfill, goes into cell proliferation or growth so that more sperms can develop. And at this age, Dr. Hammer or his whole family can think of having a baby and they can go ahead with one more child. Okay, so the psyche was continuous thinking, wish I would have had one more child. That pressure on the brain made the testis make more cells so that at that age there will be more semen production and they can think of having a child. But this
yeah, sound has gone again. Okay. The sound has dropped for some reason.
Yes. Now it will come back. I think there was a call coming. So this desire of having a child led into this type of survival, and that proliferation in the testis was nothing but a survival mechanism, and it was not a cellular growth or a tumor or a cancer.
Can I just ask you, as you explain that, what do you mean by that? That was a survival, excuse me, a survival mechanism as such.
Okay, so at this age, that organ that cannot produce that amount of sperm that he can get a child. Okay, but for the survival, I mean, I don't have a child, and that desire and that demand from the family to have one more child kept him thinking continuously and giving stress and releasing more cortisol, which was acting on the testes, because testes are responsible for making sperms at that age, so that if he requires a child or if he wants a child, he will be able to get a child with his wife, because at that age the sperms are not enough to reproduce.
Understood.
Okay.
You know, this takes me on to this connection, because from what you've said, as far as as far as the principle of German new medicine is concerned, it's very much to do with the fact that you can be as healthy as you want as long as your mindset is correct. Yeah?
Yes. So if a patient of a testicular cancer comes to me, I know what questions to ask. I know what he has gone through in his life. I know how to go about in taking the case history in homeopathy. I will straight away ask him, did you lose your child? Did you have anything issues with your child? Did your child go away from you and you wish to have one more child, and now this is not the age, but that wish is not being fulfilled, but the body and the brain wants it.
Right.
Okay. So that made me understand. So now what he did was he went on studying every organ, and then he found every organ's function goes exaggerated when there is a stress or there is pressure on the psyche. The brain immediately stimulates that organ to produce more cell so that the person will be able to survive better in this world.
That
And that is
that
cell.
that makes sense anyway, because when we are in a fight or flight response,
Yes,
the adrenals are really pumping, aren't they, at that
yes,
time,
yes,
and it's amazing how that system works in itself, because it's at that time that we need that extra boost, don't we, as far as adrenaline is concerned.
yeah. So that is called as a psychoneuroendocrine immunological action, PNEI axis, which now all the doctors are understanding that the brain is behind everything. Okay, so how it happens is, to understand a case and with relation with homeopathy, we take the mind symptoms. We usually ask the patient, tell me about your nature. Why do we do that? Why Dr. Kent has worked so much on mind chapter? Once you understand the mind, you understand the emotions. These emotions, what you were talking about, adrenaline, these emotions stimulate that adrenaline, stimulate the histamines, stimulate the serotonins, stimulate the dopamines. These are all neurotransmitters. So our emotions stimulate the body's neurotransmitters.
Right.
And those neurotransmitters, suppose if it's adrenaline, is going to push that organ to function better so that it's easy to survive in that situation. So these neurotransmitters then stimulate the hormones and the enzymes. And these hormones and enzymes, long term, if get stimulated, change the RNA, DNA, and the structure of the cell. And that cellular changes is what we call as disease or a pathology or a cancer or a tumor or a cell loss.
Right.
Yeah. So if we want to make changes in that organ or the cell, you need to go back and understand what were the emotions which happened, and this triggered the whole thing. Now, this is PNEI axis. Now, German new medicine comes into help us by understanding this PNEI axis, how to apply it in homeopathy. Just to give you an example, very simple example, that we go to a doctor when we have cold cough, allergic rhinitis. Okay, the whole area is inflamed and swollen up. So what is the function of nose? The function of nose is scent, smell. Okay, for us it is only smell. For the animals, for their survival, they used to smell danger.
Absolutely.
Yeah, they used to smell the surrounding and then take immediate action and run away to survive better. So when we have cold, we get irritable, agitated, restless, impatient. All that happens. Okay. Now, this happens because I am sure that person must be smelling some danger, or there is a scent of a person whom he does not want in the room, or he is fed up of. German New Medicine says, fed up of. What are you fed up of? Whenever the scent conflict comes into action, the histamines go up.
Right.
The histamines
Yeah,
in the
absolutely.
body goes up because of the stress. So that you can smell better. Your And immediately as the histamines go up, your allergies go up. When you go and take antihistaminics, the antihistaminics are not the cold medicines. They make you dull, drowsy, and sleepy. Any antihistaminic makes you a little drowsy and you tend to sleep. So when you become drowsy, sleep, you rest, the histamine levels falls down and your allergies come down. Again, you get exposed to that type of surrounding. Again, there is a stimulus, the histamine rise, they have to take antihistaminic, and that's where you cannot leave an antihistaminic. But once you understand German new medicine, that this person is anxious about money because husband is not earning. I am fed up of this husband, aversion to husband, anxiety, money matters. How will I raise my children? The children are also not studying. I get impatient about my children. These three rubrics, if you combine in the repertory, it shows a remedy called as Dalkamara. And Dalkamara is used in allergies very frequently.
The question here, however, that the listeners will want to probably are thinking or asking is that when we get a cold, we always think of a virus and we think of the immune system. So how does what you're saying link in with that? Because we're talking very much about irritability or where you've just given this example, the husband isn't earning enough and that. And now we're talking also about the physical nature of a virus and when it invades and then there is an immune response.
Yes.
Eventually there is an immune response. Sometimes it takes
Yes.
quite a long time, doesn't it?
Yes. So here it's little deep knowledge, but I will try to make it little simple for you. What we talk about PNEI axis, it is also about immunology. We talk about PNEI axis, the emotion, the stress, the anger, the irritability is now releasing more histamines, okay, and making you sensitive. So a person whose histamine levels are high, he will sneeze or get affected by the bacteria and virus around. A person who is calm, quiet, and is not affected by that environment will not have his histamine going up and will not sneeze or cough. So when your PNEI axis gets affected, when you are in stress, your immunity goes down. And that is the time when the virus and the bacteria attacks you. Okay. One more theory about GNM is the bacteria is your friend. Here
Right.
we have to go to when the life came into existence on this world. There was only one layer, the endoderm. Okay, everybody, the endoderm lining is from the mouth to the rectum. Okay, so it is one layer, and only that layer was there. And that time, so it is the oldest germ layer. It's the oldest germ layer. And the oldest germ layer, how beautiful it is, I'll tell you. It is the oldest germ layer. It is affected by the oldest type of emotion, the indigestible morsel conflict. So when you swallow anger all the time, and you swallow anger and emotions around your family, that affects your digestive system. When there is anger and emotion which you swallow about family and your surrounding, that affects your digestive system. And this digestive system, when goes into proliferation or destruction, the only bacteria which usually comes is the oldest bacteria, and the oldest bacteria is the tubercular bacteria. So you see all these organs get affected by the tubercular bacteria. Now when it comes to lungs, during COVID, everybody was in a state of fear.
Absolutely.
Yeah.
Yes.
The lung tissue Now, this when mine was the only clinic open during COVID officially by the government. They allowed it because I could explain why COVID, who is dying and who will not die. So when I was explaining the doctors, I told them, see what German new medicine has to say. The German new medicine has to say lungs get affected only by death, fright, conflict. Death, fright, conflict. When you have a fear that you are going to die, the lungs proliferate so that they can produce more cells, more alveoli, more oxygen intake for survival. So people used to panic when they used to get breathless, but that was something which was a survival mechanism. So death, fright, conflict, the people who had a fear of getting virus or had a death, fright, conflict were the most affected. Those,
it's very interesting. It's fascinating, actually, what what you're saying, and I'm sure the listeners, the viewers, as such on this Insta Live, are finding it just as fascinating. And I have to just very quickly say thank you so very much for the questions, but because of fiddling around with the phone to be able to read the questions again and answer, we won't be able to answer them today, or Dr. Asher, I should say.
yes.
But certainly you can contact him, and I will share this this recording anyhow on my Insta live on my Instagram account, which is like_treats like. I was just going to go back there. You see, the problem that somebody may ask, the problem with all of this is that if you have this fear, let's just take COVID, and you're suffering and you're finding you're straining to breathe, then at that time people have this, of course, naturally the phenomena is that we panic because nobody wants to die. So how can one really truly explain that, look, this is the process and you have to be patient? Because there comes a point where somebody says, no, but the fear, am I going to wait for something positive to happen, or do I just take a almost dare I say it, the wrong word, but do I take a coin flip, a gamble as such,
No, this is just to identify. Once you identify, naturally there comes homeopathy. So fear of death, fear of contagion, fear of being injured, fear that the time has come and I'm going to die, fear of cold air draft, that time I will get sick. These are the rubrics which were used to come to arsenic, aconite, and the remedies. So naturally, as we know in homeopathy, when you give these medicines, the situation improves. The person feels more calmer. The person's histamine levels are less. He's mentally more stable. And that medicine goes and helps him and cures.
Now, I'm going to ask you something that I know you're very, very passionate about. And I must actually say, bravo, because of the knowledge that you have. It's really interesting. And, it's, I think it's so important to understand this from where you're coming from as far as this system of German new medicine. Can you give us an example? If we start with the nose, because you use that as an example, and the cold, and how you would help somebody in that situation through the principles of German new medicine.
So I gave you an example.
From a cold, sorry.
Yeah, so I gave you an example of Dalkamara, how you use Dalkamara. If you see, Dalkamara is ameliorated by warmth, okay? And Dalkamara is aggravated by cold, chilly places. What does, on the mental level, Dalkamara, if we need to understand, says? Dalkamara is getting irritated and impatient about his children. He is feeling that she is being neglected by husband. There is a lot of anger and agitation in the family. There is no warmth in the family. So what does the Dalkamara want mentally and physically? If you see, it's the same. It requires warmth and love in the family. And she is aggravated by cold, chilly place. So chilliness and cold place are not comfortable if you're not wrapped up properly. So where we understand the mind and the body and the physicals, it is the same. So this Dalkamara, if I have to use it, naturally I'm going to take these rubrics. We need to really take these rubrics if you're treating this acute cold. But now, as I've already told you about Dalkamara, I can tell you some other disease, maybe which is very common, is arthritis. Okay. So
before you go into that, just for the listeners, what you've said is actually very, very important, and I 100% agree with you, because I had Kim Elia, who is the producer of the upcoming film introducing homeopathy, and he was talking about Constantine Herring and about analysis of remedies, and I'm sure you've read this paper, and he
yes.
talks about the diagnostic method, and a patient who is a nux vomica will not just be physically a nux vomica, but emotionally. So what you've said is absolutely 100%, because I've spent a lot of time on this myself now, and I think it's so interesting. But something you may also find interesting, or you may already know, Dr. Jan Scholten speaks about in his new book about personalities and how different scenarios in our life, like money worries, like, God forbid, an abusive relationship, or other issues, trials and tribulations, they add a layer of personality upon the individual. And that makes me think of GNM now, because personalities, obviously, we know with homeopathy we work in layers as well. Sometimes we have to. And it's interesting, isn't it, how all of this seems to be coming together so nicely.
Yes. So the layers are endoderm, ectoderm, mesoderm. These are the layers. And according to the layers, our medicines also have shown progress. And when the patient comes with a symptom, if you know these layers, ectoderm, endoderm, mesoderm, you know at what cellular level he's healing.
Right.
Yeah. That is. So I was talking about arthritis. In a short, I will tell you, because this has become very common. Everybody has a joint pain. Okay.
Absolutely. Yes.
Yeah. So in German New Medicine, the right side belongs to the partner, father, and territory. Right side belongs to partner, father, and territory. The left side belongs to mother, children, and siblings.
Okay.
Okay. So if you are suffering from joint pains, especially if you're suffering from a shoulder problem, a frozen shoulder problem, and you have been going to do physiotherapy, painkillers, and it's just not working out. So when a patient comes to us with applying German New Medicine, we know the right side is something to do with the partner or father or work. The first question which we will ask is, what responsibility about your father or partner you are not able to shoulder? It is causing stress, and this patient will go into a shock. How do you know, doctor? How do you exactly know? Exactly, that is an issue in my life. They'll ask, tell me, who is it? So he say, father. Then what about father? My father has diabetes. He doesn't listen to me. He does whatever he wants to. He eats sweets. I am a lone caretaker towards him. While leaving to office, I instruct him not to do all these things. But as soon as I go to the office, I get the phone call from my neighbors that your father has eaten this thing. His sugar is high, and you have to come back. It is becoming impossible to take this responsibility. So mentally, psyche is like, I cannot shoulder this responsibility. He is imagining the father sitting on his shoulder continuously, and that is causing cortisol and adrenal release. That is stiffening the muscle. Now that father is not valuing his son, so he feels not valued and devalued. So the conflict in GNM says not valued, devalued, and loss of self-worth. So the father is not valuing him. So this conflict affects the bones. How does the bone react? The bone go into destruction. There is osteolysis, osteoporosis, continuous stress. The muscles go stiff. So naturally, the blood circulation to the bone goes down. and you get all those osteoporotic bone and stiff muscle. So here we have to take the rubric ailments from responsibility. Okay, you straight go there and take the remedy. I think there are 4 remedies in it. You take ailments from responsibility and you see his adaptation. His adaptation is, it's my responsibility, it's my father, he doesn't listen, but I have to do it. What will be the society telling me? I have to answer my society if I don't take care of my father, is aurum. And that easy it is to give aurum, and you say changes in the x-ray, the osteoporosis improves, the stiffness goes down, and his frozen shoulder goes down. Now there is a understanding that every lady after menopause goes into osteoporosis or needs calcium. But why? Because after menopause she feels she is less beautiful, she feels she's not wanted by the husband, she feels the husband doesn't look towards her now because she has gone old, so she feels devalued. That devaluation feeling reduces his calcium. So calcium is needed not with every menopausal lady, only the female who feels not valued by husband requires calcium. But that feeling also should go. She should accept that, okay, I've gone old, and should talk to the husband, and she needs a homeopathic remedy for the feeling which she's going through.
You know, you're smiling as you have been speaking, and I know why, because you love what you're doing, and I can feel that passion, and that zeal that's coming from you, and it's a fascinating subject. So do give us some more examples. Very, very interesting indeed, and I'm quite sure, confident actually, that the listeners and those who will listen back are going to find this very, very interesting indeed, and will want to know much, much more.
Okay, I'll give you a common example, a common PCOD, very common now.
Yes, very
Polycystic
unfortunately.
ovary, very this, and people are taking medicines, metformin, and there is no solution coming in. They are getting hair grown, and then they're going for laser. No, it's very easy to understand. So if you read Learning German New Medicine, you have to understand the conflict. Now, every girl with polycystic ovarian disease, I must be having around 700, 800 patients cured before and after reports, who all, so you know why I trust German New Medicine? What is written in German New Medicine, exactly those words are repeated by every polycystic ovarian disease girl or a lady. Okay? And what is it written? It is written loss conflict. Loss conflict. If a fear of losing a loved one also can trigger the conflict. She goes into PCOS, the syndrome. So, losing a boyfriend, fear of losing a boyfriend, very possessive about boyfriend, fear of losing the family, fear that I will lose my job, fear that I have an ambition to achieve, and being a girl, I cannot do it, so I should strive hard, be like a man, and really strive hard and achieve my position. So all these things, to achieve a position, to do something, to compare herself with a boy, but the brother is getting all the attention, I am not getting that attention, or in the house, I have to be like I. So that fear of losing that position also can trigger PCOD, and this is very common nowadays. Every girl wants to become a CEO or has an ambition. It's not wrong, but they have to be aware that they don't have to compare themselves with others, because that shoots up the adrenaline, that changes the hormones in the body. So loss conflict. So just telling you a case, I had a case of polycystic ovarian disease, 7 months, no menses, and the reports were bad, and the girl was brought to me. And the mother said, I want to get her married, doctor, but the menses are not coming. And the doctor said that there will be problems in the pregnancy. And she is already on the drugs. Whenever she takes progesterone, she gets menses, otherwise, no menses. And the ovary shows cystic changes. So now, what are you going to ask this girl? I said, did you lose anybody? Did you have a boyfriend who, or there is a breakup? Is there anything which you are want to tell me where somebody you have lost? So she said, no, everybody's alive, everybody's fine, yeah, wo. So I said, then tell me about whom do you like? So she said, the person mom was talking about, I am supposed to get married. I have issues with him. I said, what issues? So she said, doctor, that guy, I love him a lot. And but that guy has a sister. That guy is around that sister all the time praising her. I don't like that. I hate her. And when I tell this boy that I don't like her after getting married, I don't want to stay in that house, I don't want to see her face, I really hate her, he gets angry. He listened to me 2, 3 months. Before all these symptoms started, one day he fired me. He said, I don't think we can continue. I have to tell my family my supposed to be wife doesn't like my sister. She says she will not stay in this house. So I have to break the relationship, the mangni, which they call. And since that month, her menses started disappearing. So if you read German New Medicine, it is written, fear of losing the loved one can also trigger this. Now, what happens?
I tell you something really interesting. As you were explaining that, I was not only listening, but so many patients came to mind who have PCOS that I'm treating at the moment, who are so similar to what you've just said. In fact, I can't say similar. They are, because they're openly talking about these conflicts that they have, So what a fascinating system indeed.
Yes.
Do give us, we are going to, for the listeners, actually, we are going to have a number of these Insta Lives with Dr. Asher Shaikh. And I think it's a very important subject, and the principles of German New Medicine are quite important so that we understand them and we're able to, for the practitioners, certainly for the doctors listening, very important to be able to have this tool in our toolbox as far as homeopathy is concerned. But for now, do give us another example. I'm like so, everybody else. I think I'm thoroughly enjoying this.
So the rubrics naturally were of Platina, jealousy, contemptuous, fear of rejection. The rubrics also match to our German New Medicine. Fear of rejection, ailments from losing a position. Loss of position, rejection is what Platina doesn't like, and this female also did not like. So Platina, within 2 months, her menses came. We did her sonography after 6 months. We have these reports. Her all parameters came normal. So this goes on. The other example I can give you is, again, we are talking about females. So we are going to talk about breast cancers. So many patients go and get themselves investigated unnecessary. There are camps to detect breast cancer or lumps. A small lump, a small lump.
You lit up there like the Burj Khalifa. I don't know what that was.
I don't know. Something happened on the phone and.
Happy New Year. We know.
Yeah, Happy New Year. Insta is celebrating this conversation, I think. So what happened is, she was a lady who was 72, 73 years old, and she had a lump since a long time. And then suddenly this lump started paining, and the doctors checked her prolactin levels, and the doctors said there is growth in this. The Byrate's grade, the grading which is done, is on a higher level, and she has to get operated. So all these cancers or the breast tumors are what does German New Medicine say is, so the PCOD survival mechanism there was, by bringing in cyst, there should be less estrogen, more testosterone produced, so that person can fulfill his ambition. That was a survival mechanism over there. That's the reason so body doesn't go into diseases. It's just a survival mechanism. Here, the breast is what German New Medicine has to say is nest worry. Nest worry. Just one word, nest. a nest, a bird's nest. Nest, worry, conflict. Okay. So what are we going to ask a patient who comes to us who doesn't want to get operated, and that age she really is not in a situation to get operated, or the doctors are not going to touch. Usually patients come to us in these situations only, where the doctors say, okay, we can't help you, you try homeopathy. So then they come to homeopathy. Now, nest worry, what questions we are going to ask? I straight away ask this lady, what nest worry you have? What is that worry which is eating you up of your house, home, nest? Your nest is your house. And she said, immediately started crying, weeping. And that is enough for me to understand, okay, I'm hit the right target, right question. She said, I have one son. My husband have expired long back. I have one son. I taught him. I made him what he is today. He went to US and I used to tell him on phone, make this food, have you eaten this, that, all the time worried about him. Then he got married without telling me. That was again a shock. Again, I started caring for her. One fine day, that lady is calling me and telling me, stop worrying about your son. I am here to take care. Please stop calling him every day and pushing him to do this. He gets irritated. That was again a shock. All the time, she never used to sleep worrying what the son was doing and whether he was eating well, was the new girl who has come in his life making food for him. And that care and worry at that level increases the prolactin because she wants to feed the child at that age. The prolactin goes up, the tumor size starts increasing. And what I said, left and right, left side and right side. So naturally, it was his son. So the breast cancer was on his left. So it is related to child. Then when we created the totality, so here the totality is ailment from cares and worried about loved ones. She is sleepless because of worries. Because of sleeplessness, she gets vertigo. All three symptoms straight away showed us Cocculus was the remedy. Cocculus 30 in repeated doses and later on plussing doses, help will completely come out of this.
Amazing, really amazing. Dr. Ashra, I'm being asked some of the the members who are listening in today. Firstly, thank you very much, of course, for tuning in. The one question has come up about the books and repertories that you're referring to. So if you could guide the listeners what books they should be looking at and where they're available.
Yes. So there's a site called learninggnm.com.
Okay.
learninggnm.com. Caroline Marcolin is the main owner of that website. You can get that all the knowledge from there, what I am. So, but then it's a little difficult English to understand. You know, it's like the whole anatomy and physiology, knowledge of disease aphorism. It's like,
yes.
I learned this in 2013. Now in 2021, after that COVID break and all that, which I got time to study, I could master it. Okay, so it took me 7-8 years to study that whole website and their books. So learninggnm.com is one book which you can refer online and learn everything. The repertory which I use is, the software which I use is either Radar or I use Synergy.
Both of
But
them
when
are
I have to search,
Both of them are excellent.
When I have to really search, then Synergy. If I have to operate fast, then I use Radar. In that, the Schreien's repertory or the complete repertory is what I refer. The books usually which I refer to see the pathologies are Borix Matra Medica or Clark. To see the sphere of action where I go and refer. So these things I keep around me, and once the patient is there with a very calm mind, because I know what disease causes what problems, what emotions rather cause what diseases, I will straight away look into the eye of the patient and ask, did this happen in your life? He will say yes. My first rubric will come from ailments from. For example, the Platina case, I said the first rubric I came to my mind, ailments from loss of position. She wanted a position in the house and this person rejected her. So ailments from will come, and from that ailments from the whole totality builds up, and that totality, when it builds up, it beautifully resonates with German new medicine. Both are the nature's law which they follow, and every tissue in our body is going to behave that discipline. The endoderm will proliferate, the bone will always go into disease in sort of cell loss. Okay, the ovaries will always go into cell loss. The uterus, always you will find fibroid, cell multiplication. So I will know where what is multiplying and what the loss is going to happen. So when you give a right remedy, the loss has to fill up. And when you give a right remedy in proliferation, the proliferation has to regress. The cells have to regress. But you also have to make patient aware why he is suffering. Because if this guy is jumping every day and coming with bone broken, again you give symphytum, again he's jumping and again you give symphytum, it's not going to work. You also have to advise him that this in your life has made you sick. Please work on it. Please stop doing it.
I love the way how you are so calm. So German new medicine has certainly been helping you to remain very, very calm and calculated. And
Yes.
I know that you tell us a bit about yourself, Dr. Asher, because I know you teach all over the world, and you have a clinic in Dubai as well.
Yes, yes. So I have my main clinic I have in Nasik, because this is a place where I was born and brought up. So I have a team of around 18-20 doctors who work together in our clinic in Nasik for those patients who are chronically sick and they need a stay. I have a resort called as Viveda Wellness Village. It has 32 rooms where we try to reverse all autoimmune disorders, diabetes, thyroid, everything. If you are on those medicines, we will see to it that you can reverse those things and give you that life which used to live without that medicine before, by identifying, using German new medicine, using homeopathy, guiding them to live that lifestyle, teach them yoga and send them back. Then this whole project, when was seen by my friends in Dubai, they made me meet the owner of Medcare, who liked the whole concept, who saw my presentation. I showed her all pathological cases, the best pathological cases, which I had reversed. Then she said, "Oh my God, I have so many cases in Medcare hospital, which we can give it to you. Please work on them, because these are the patients who are really suffering." That's how I am now making my team in Dubai. So I have now 2 doctors. I will be increasing them and having the same setup what I have in Nasik, Mumbai, Pune, and now Dubai.
And hopefully this year, God willing, London, UK, where I am.
Okay, sure. I will surely come and meet you, and let's see how we can work out together.
Absolutely. Dr. Asher Shaikh, it's been an absolute honor to have you on my Instagram and my Insta Live, should I say. And I think I'm looking forward to having you back next week, and we can hold part 2 of this conversation, and we can carry on with German new medicine. But the questions, as far as questions are concerned, if you send me the questions to me, firstly, this is being hosted on my Instagram account, which is like_treats_like. So actually, please do follow me, because I have a podcast as well as this Instagram live series. The podcast goes out to hundreds, thousands of people around the world. And Dr. Asher Shaikh is actually going to be a guest in the next few weeks on the podcast. I'm very much looking forward to that.
Thank you.
But do send your questions for today's Insta Live to me, and I will forward them to Dr. Asher Shaikh. And until then, do keep in touch as far as the reels are concerned, and you'll be able to watch this back. I think it's a really excellent introduction to GNM, but there's so much more. In fact, I've just had the idea now, Dr. Asher Shaikh, that if I receive the questions, and you can do that through my Instagram or through my website, which is liketreatslike.co.uk. Then next time when we do part two, I can ask you
Yeah.
those questions, and you can actually answer them on behalf of
Same
the
questions. Yeah. And I'll give
yeah.
examples to that.
Yeah.
Yes.
I think that
Yeah.
will make it
Thank you
very
for
interactive as well.
yes,
But
thank you for having me on this show. Thank you so much. Nice.
you are a wealth of knowledge and a breath of fresh air.
Thank you, sir. Thank you. And I hope to work together in London soon.
Absolutely. I look forward to meeting you, and I'll take you to the best place for some food and